If you are someone who is not active pre-pregnancy, you are not used to lifting that kind of weight. Yeah, don't do that. Don't go start, trying to lift a 100-pound barbell. Don't do that. But that doesn't mean that you can't work out. Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau,
Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you're trying to conceive, pregnant, postpartum, or beyond, you're welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details.
Welcome back to the Vibrantly You podcast. Today, we are addressing a common workout myth: not lifting too much weight in pregnancy. Many people get the recommendation to not lift over 15 to 25 pounds, which I feel like can create a lot of fear, especially maybe you have a toddler and they're already 40 pounds. Are you supposed to lift them? Can we talk about where some of these myths come from today, Meg?
Yeah, so I think this myth of only lifting 15 to 25 pounds started out as general guidance, probably when we didn't have a lot of research on exercise in pregnancy, because this field is still generally new in the grand scheme of things. So I think it came from good intentions, but like you said, has created a lot of fear for people. And for a really long time, pregnancy was seen as something that was like a disability, and that it was always recommended to rest, put your feet up, don't work yourself too hard. And again, while that advice was well intentioned, it's really not practical for a lot of people who are pregnant, like you said, especially if they have kids, but also it's just not helpful to a pregnant body. We need to strengthen it. So I think if someone is new to exercise and they really haven't been active, providers do tend to err on the side of caution and do recommend this lower amount of weight, most likely because it's generally safe for everybody, right? But again, it is a guideline. It's not a hard and fast rule, which I think is how people tend to interpret it.
Yeah, I think especially when it comes to exercise, it should be more of this sliding scale. Like you can work with your provider and again, like perinatal fitness experts so you can determine what is actually safe for you as the individual person, not just this like blanket statement. So if people are confused about that, how do they create this again this plan with their workouts where it's safe for them?
Yeah, so let's say someone has not been active at all pre-pregnancy, because there's also this advice of like, oh, like you can just keep doing what you've been doing. I see that all the time. I literally just saw a TikTok about that where this woman was lifting heavy weights in the gym at 38 weeks of pregnancy. And I was like, yeah, like this is awesome. And then I go to the comments and everyone's like, don't do this. Don't do this. Like, this isn't safe. Just like this misinformation and this fear. And if you are someone who is not active pre-pregnancy, you are not used to lifting that kind of weight. Yeah, don't do that. Don't go start, trying to lift a 100-pound barbell. Don't do that. But that doesn't mean that you can't work out. So, if you have been cleared to work out by your doctor, you don't have any pregnancy complications, they've been like, yep, you're good to go, it is perfectly safe to start a workout routine in pregnancy, even if you were not active before. Even if this means that you are going to be doing something that your body is not quote unquote used to. But like I said, you're going to want to start off slow. You don't want to come right out of the gate doing overhead presses with 25 pounds, or like I said, squatting with a 100-pound barbell. We want to be smart about it and start slow with low weight.
That makes a lot of sense. Again, you're taking this individual approach based on where that person is at in their fitness journey. So even if they are someone who is brand new to working out or it's been a while, where do you suggest they start with lifting weights?
Yeah, so the very first thing, especially with pregnancy, is starting with breathing technique. And I know I talk about this in other episodes. I talk about it all the time, but we do this through 360 breathing. So this is where you're getting a nice deep inhale breath, letting the chest, back, and belly expand, and then a big audible exhale through the mouth. So you can actually hear that breath and feeling everything contract in. And then we're going to pair that type of breathing with body weight exercises to start. This way you can master your form before you're starting to add on weight. So making sure that your form is good so that you don't hurt yourself. And then pairing that breathing technique with your form. And then once you're really good at that, this is when we start to add load. And you can do this through resistance bands, dumbbells, kettlebells, whatever you have available. Starting low though. And then as you get stronger, you can increase the weight. So again, that's going to look different for everyone depending on your baseline level of fitness and also depending on how your pregnancy is progressing. Because even if you are someone who is, say, 10 weeks pregnant, you've been cleared to work out, everything's looking good, you could get to your anatomy scan and find out that you have uh, placenta previa, right?
Yeah,
Um, where your placenta is, covering your cervix and you can't work out, or like, something else comes up. Pregnancy is so unpredictable. So it does depend on how your pregnancy is going too, on how this might change.
yeah, I think that's great. Like we're taking that progressive overload throughout, but paying attention again to how the person is doing and how their pregnancy is progressing. And so let's say now the individual might be someone who has come in. They've been consistently doing some form of resistance training prior to pregnancy. They have a decent amount of experience. Is there any kind of max limit or other considerations and approaches that we want to incorporate?
So if you are a seasoned exerciser, weightlifter, honestly, no. It depends. It's very individual. So I'll use myself for example, but when I was pregnant with my daughter in my last pregnancy, I was, before I got pregnant, I was super consistent and I was postpartum then, so I wasn't back to necessarily my pre-pregnancy weights that I was lifting, but I had been consistent. And then I got pregnant. And even on my like heaviest workouts for lower body, I was still probably only around like 40 pounds. And normally, when I'm not pregnant or early postpartum, I can lift more than that. But for me specifically, that first 16 weeks of my pregnancy with her, I was so sick that I could not even get off the couch. So I was doing nothing. And then once I could start working out again, I developed SPD, which is symphysis pubic dysfunction, that pain at the front of your pelvis at the pubic bone. So I had to be really mindful of that when I was exercising. So I was not at a point where I was trying to push myself or trying to really increase my weight or like hit PRs. I just wanted to stay consistent in movement. I wanted to support my body as it was growing. I wanted to prepare for birth. I wanted to help manage that pelvic pain. So you also have to take into account the individual's circumstances. So, like for me, I was dealing with pelvic pain. I had taken some time off, but also the goals. So, someone who maybe is a really experienced weightlifter, their goal is to like continue to lift heavy throughout pregnancy, and that's great. But if you're someone like me, say, where you were pretty active and you have been lifting weights, but you have other things come up and your goal is like, I just want to, manage this pain and get ready for birth, then that's going to look a little bit different. So I would say a good rule of thumb, though, for everybody is if you're starting to see a breakdown in form. So if you're lifting heavy and you're starting to notice that your form is struggling, or you're noticing more pelvic floor symptoms, like maybe you're starting to leak when you're squatting, or you're feeling pain and pressure in the pelvis, that would be a sign to me that you should start to pull back on the weight because your body can no longer handle that amount of load.
I think that's really good advice as far as, again, taking those individual needs into account and also still having guidelines for what they can look for because certainly, while those types of symptoms can be common during pregnancy, it's not the like norm. We don't want that to be happening while you're lifting. So, if someone, let's say, new new example, that person is consistently weightlifting, but like you said, maybe they took a break during their first trimester and they're nauseous like you experienced. How should they approach getting back into it? What would you recommend? And are there any special considerations there?
Yeah, so this is a question I get quite often is someone who was consistent in the gym or, at home workouts, but they got really sick in the first trimester. They stopped working out for a month or 3 months, and then they tend to panic because they're like, I don't think I can get back into it because now my body has changed, so I'll just do nothing. And they start to spiral. And that's not true. You can still get back into it as long as you've been cleared, but you're going to approach it the same way as someone who is brand new to working out, like our first example. So, again, starting with that 360 breathing and body weight exercises and building from there. But I would say if you're someone who was working out before, you'll probably progress a little quicker than someone who is like truly a beginner. And you'll probably be back to the weights that you were lifting pre-pregnancy more quickly. So, again, the theme of this episode, it depends and it's individual, but don't think that just because you had to take a break for whatever reason, even if it wasn't just that first trimester nausea, or like maybe you were, put on bed rest early on because you had like a bleeding scare, or whatever it is. As long as you've been cleared by your doctor, it is safe for you to get started again once you're feeling well.
And I think those kinds of different scenarios can be anxiety producing and cause fear to get back into it. And so I think, again, having just these like general considerations so that you can feel more confident with things as you progress is really helpful. So, as we look to wrap this up, are there any considerations for like that third trimester as birth approach in terms of weight limits, or also because your center of gravity is starting to shift and your belly is a little bit larger? Are there any other things that we should really be aware of during that third trimester?
Yeah, so like you said, this is a time when the center of gravity has shifted because as we move through pregnancy, the center of gravity comes out and up, so that can throw your balance off a little bit. The belly is the largest, which can just cause, you know, physical changes to what your workouts look like. But also, this is typically when people tend to experience the most pain and discomfort in pregnancy. So, again, it's going to be individual. But if you are someone who works out with a barbell, typically I find, especially in those last couple of weeks, like 4 to 8 weeks, moving to dumbbells and ditching the barbell just because of that belly being larger. We just want to err on the side of caution. But again, it totally depends on the person and how comfortable they are with a barbell. Some people are using barbells all the way up until they give birth. So, depends on you, what you're comfortable with, your form, all of those things. But I will say that decreasing weight is pretty common at the end of pregnancy because of the changes we already mentioned, and just because you want to start shifting more towards birth prep stuff, which is going to look like mobility, pelvic floor release. We want to start to conserve some energy as we're, waiting for labor to start. So those last 4 to 6 weeks are not necessarily the time where you're really wanting to push yourself and increase those weights. It is typically when you want to back off a little bit.
Yeah, I remember that feeling that way with Gianna. I think the last probably month ish, it was a lot easier on myself to maybe pick fewer exercises in a session and to spend more time doing like mobility work or just movements that felt like they were helping me feel more comfortable as things got uncomfy.
Yes, exactly.
So, at the time of this episode airing, I know you're getting ready to host a free strength class for pregnant mamas. Can you please tell us more about that and how people can register?
Yes, so I'm going to be hosting a Strong in Pregnancy free class on Wednesday, April 2nd. So this will be roughly an hour long, hosting it on Zoom. We're just going to start out with some information on exercising safely in pregnancy, like going more in depth on some of the things we talked about today, and then follow that up with a workout. It is designed for all trimesters, safe for all trimesters, and it's free. There will be a replay available if you can't make it live. So if you want to register for that, we will add a link below in the show notes.
Awesome. Definitely make sure to check that out if you're pregnant. And I think that wraps up today's episode. So if you found this info to be helpful, please be sure to share with a pregnant friend and leave us a review and we will talk to you guys next week.